I have a 10-year-old daughter who thinks she's going on 20. My son is now 14 months old, almost 15 months. And I have my fiance. We all live together, looking for more housing, bigger housing now that we've grown. I ended up filing for bankruptcy because I could not afford to pay $14,000 for a medical surgery. I noticed, like, the insurance, they would say that I've met my maximum on certain parts of what they were gonna pay for, and that started to create more, medical bills. I found out, pregnant. I had just went through bankruptcy, so it was kind of to a point where I knew I couldn't afford to have a baby. What do we do now? Because a baby is very expensive. My health isn't the greatest. It was completely unexpected to have a baby. We were forced to make some difficult decisions, and then I found out about the Medicaid expansion program. It was a tremendous decrease. The insurance that I had before Medicaid wouldn't even pay for the ultrasound, so I was paying 100% out of pocket for every ultrasound. It was with like a month after my C-section, they actually had to go back in and try to do a tubal ligation, which they could not successfully do. That was something I wanted to have done before I left after my son's birth, because especially with all of the complications and the health issues that I had, but they had to also do it within the timeline that my Medicaid would still be active because of the short period that you would be covered after having the baby. So it just never happened. I had postpartum depression, and we were kind of secluded at home because of COVID restrictions. So I fell through the cracks. I didn't have insurance. Anytime that I would go to any of my son's wellness visits, and they ask you the postpartum questionnaire, and you answer it honestly because you want to be honest, then they treated you like they were afraid to let you leave with your child. If I would have had Medicaid for the rest of that year, I wouldn't have endured that stigma. I would have had a stronger support system, and maybe I would have been able to help my older daughter adjust better because I would have been more whole. The cardiologist wanted to do an ultrasound of my heart, and I didn't have insurance at the time. So that was something that I wasn't able to afford, and I told him no, I could not do that at that time. They've learned that I've had autoimmune disorders as well, all within that year of postpartum. I really feel if I would have had that extra support, I would have been able to try to either do the tubal ligation again, be able to follow up sooner with that cardiologist, afford medications, the extra finances that came along with the loss of insurance, the loss of support. It was really challenging. So if my story will help other people, then absolutely that's what I want to do.